Welcome back to BNC Live. I'm Sheldon Lanier. September is Childhood Cancer Awareness Month, and pediatric cancer is the leading cause of death by disease for children under the age of 14. 43 children are diagnosed with cancer each and every day in the U.S. And in 2012, President Barack Obama proclaimed September to be National Childhood Cancer Awareness Month as the country continues to understand, treat, and control the disease. Now, here to discuss more is pediatric and public health expert Dr. Yolandra Hancock. Thank you so much for joining us.
Thanks for having me.
So can you explain what causes cancer in children? You think those are the most vulnerable, those are the ones who should never get a disease like this, but what causes it?
That's an excellent question. We know that cancer among children, thankfully, is very rare, but based on the statistics that's just reported out, it's likely more common than people assume it to be. About 10% of cancers are linked to genetics. Cancers like retinoblastoma, and there's certain syndromes that are linked to cancer development, such as Down syndrome. Down syndrome, little ones with Down syndrome are actually at increased risk for leukemia. But the majority of cancers, it's hard for us to know really what the underlying cause is. There are some studies that show evidence of exposure to chemicals. We know that exposure to cigarette smoke puts children at increased risk for cancer. Pesticides, asbestos are sort of the classic things that we think about, but some things that parents don't often think about are the products that we put on our babies and our little ones' skin. What we're putting in our hair and what we're putting in our bodies. Those are the things that we really have to pay attention to because they may have something called endocrine disruptors, those chemicals that can affect the risk of breast cancer, prostate cancer, and other of those solid tumors, as well as risk of the most common cancers such as leukemia and lymphoma.
And just to be clear, when you talk about putting these things or exposing these things to our skin, do you mean also the mothers while they're pregnant as well as the children once they're born?
That is a very good question. Absolutely. The little ones, as they're developing inside their mother's they're exposed to what mommy is eating, what she's drinking, what she's using on her body. The placenta absorbs all of that and it's transferred to the fetus. So we have to be mindful, even pre-conception, of how well we as folks who are attempting to have a baby, how well we're taking care of our own health, paying attention to the products that we're using on our bodies, using on our hair, and the foods and beverages that we're eating. That's
a great point, because I remember taking a medicine before we had children, and even on the medicine it says if you plan on having children anytime soon, avoid taking this and different things like that. So even for the father, it can affect what you put in your body. So thank you for clarifying that point. Are there any early signs of things parents can see or detect to help them understand that there may be some type of cancer developing or already developed in their child?
That's a very good question. The most important thing is to really pay attention to family history. With certain genetic disorders, there will be a pattern where your uncle, your niece, your grandmother, your brother, your sister may have had that cancer. You will see it showing up more often than is to be expected. The second is really paying attention to little ones. When a little one is complaining that they're tired, if you're noticing that they're a little pale, it does not hurt to ask your provider to get a complete blood cell count. We know that leukemia is the most common cancer among children, and something as simple as a CBC, that complete blood cell count, can help to screen children for a cancer like that. So anytime something does not feel right in your mommy or your daddy gut, make sure that you're advocating for your child and don't let any healthcare professional just poo-poo your concerns away. I had one patient who had recurrent headaches. Both she and myself were concerned that she may have a brain tumor. We had to fight with the neurologist in order for us to be able to get an MRI approved, and she ended up in actuality having a brain tumor when instead she was being diagnosed as having persistent migraine headaches. Luckily, she survived it and is now a mother herself. I know it ages me a little bit, but I'm happy that I was able to advocate with her mother to make sure that she got the services that she needed, especially for us as Black and brown people. We have to advocate for ourselves to make sure that the symptoms that we observe are not just pushed aside.
Wow, hey man, look at you out there saving lives, fighting for the common people. I love that. You mentioned earlier genetics. For some people, they don't know who their father is, they don't know who their mother is. Are there tests that can be done to kind of get an idea of what type of pre-existing illnesses were in your family members from the past you may have never even met?
That's an excellent question. It really speaks to precision medicine. In a general sense, the answer is yes. I think one of the things that we have to address, particularly in the African American community, is hesitancy around genetic testing. When we
Mm.
start talking about getting our genes tested, folks get real nervous. But the direction of medicine is in precision medicine, where we're looking genetically at your DNA to see what you may in the future be at risk for. It is going to be the future of medicine. And my hope is that African Americans, the Latinx community, that we're more comfortable with that direction of medicine so that we know what our risk is.
Mm.
But for the most part, particularly when it comes to children, it really is feeding them a healthy diet, paying attention to what products we use for them, and keeping an eye out for any concerning symptoms that may develop.
Okay, so let's talk about when we're talking about these child cancers. What are the treatment options that parents have to help them through this? Are their bodies even strong enough to withstand leukemia?
That's a very good question
Or
as
chemo,
well. You
that's
know,
what I was
certainly
thinking of,
children are
chemo. Chemo
chemo.
treatment,
Yeah,
yeah.
I got you.
All right.
One of the reasons why I went into pediatrics is because children are so incredibly resilient.
Mm.
And of close to 16,000 children annually who acquire cancer, 80% of them survive and thrive through treatments. We do lose 20% of children to cancer every single
Mm.
year, and it doesn't. It weighs heavily on the heart, and certainly their survival rates among children is better than in adults. It's one of the reasons why it's important for us, particularly as Black and Brown people, to participate in clinical trials. That's where a lot of the discoveries take place in terms of what are the most appropriate and successful ways in which to treat childhood cancers. But the problem is there isn't sufficient diversity within these clinical trials for us to know for our children how well they respond to these same treatments.
Mm. Well, as you know, we're still in the middle of a pandemic here, and the pediatric hospitals are overwhelmed. The kids are unable to actually get vaccinated. So how is COVID impacting children with cancer?
That's a very good question as well. One of the things that we have to be mindful of is immunocompromise. And when children are actively receiving chemotherapy, or they may have received a transplant, such as a bone marrow transplant, to help with leukemia, it puts them at even higher risk. So not only are they not able to get the vaccine, but because their immune systems have either been weakened by chemotherapy or by a bone transplant or some form of transplant needing to take immunosuppressive drugs, it puts them at additional risk and gives us even more responsibility as adults to make sure that one, we're masked up, two, that we're vaccinated, and three, that we're doing everything that we can to bring down community transmission of COVID-19 so that our most vulnerable little ones are protected from this virus.
I tell you, it's great information. Dr. Yolandra Hancock, thank you so much for coming on and just bringing this awareness to people today. We appreciate your time.